What is a dental consultant? What exactly can they do for a dentist in their practice, and what value do they possess? These are the kinds of questions that are very common when it comes to the job description of a dental consultant. I cannot speak for every experienced or brand new dental consultant out there, but what I can do is speak for my own values and beliefs as a dental consultant. My name is Jaime Smith, and this video is going to be slightly different than other dental consulting videos. Instead of talking about exactly what dental consultants do when they're hired, or even why you would want to hire a dental consultant, instead I'm going to discuss the 6 critical points I feel are in fact critical to remember when owning and operating a dental practice. These are my 6 tidbits, and after you hear my 6 tidbits, I hope to become a dental consultant you will remember in your future in case you ever need to hire one. Tidbit number 1. Establish your own personal goals the second you decide to open your own practice, because this helps set the practice's operating culture and future achievements. As a dentist, does a small, intimate dental practice fit you better? Or do you see a future practice that has 2 to 3 full-time dentists treating over 1,000 patients a year? Do you have to make these decisions immediately? Absolutely not. But you should at least have some idea on what your ultimate goal is for your career as a dentist and your practice's goals. Tidbit number 2. Establish the goal system for your employees and make certain they are relevant. Providing goals and incentives for your employees is an excellent way to encourage them to work to the best of their ability, and the ending results are usually a win-win for everybody. The employees reach their goals, and receiving their rewards brings that excellent feeling of accomplishment, which pushes them to meet their next goal. And since more times than not, a lot of the goal systems in dental practices are focused on daily, weekly, or monthly production amounts, you too win by achieving those production goals as a practice. Tidbit number 3. Create and work to maintain relationships with other dentists and dental specialists within your community. This is especially true if you are a dental specialist, because not all dentists enjoy performing root canals or extracting impacted third molars. When a general dentist sends a patient your way, this indicates that the general dentist respects and trusts your work as a specialist. Respond immediately to those referrals with thank you cards, thank you phone calls, or even thank you gifts. Tidbit number 4. The core of your practice are the patients. They are your customers. Customer service, patient service are one and the same, but how often do dentists forget that the reason your practice is a success is because of your patients and how you choose to treat them? Patients may not always be pleasant, and some can be very difficult, but as long as your practice respects the patients and their choices, maintaining long-standing patients should be a lot easier. Also, when your patients refer other patients, send them thank you cards, give them thank you phone calls, or even thank you gifts. Tidbit number 5. Just as your patients are the core of your practice, your employees are one of the biggest assets in your practice. Think of it this way. You have personal assets you take care of, and your employees are assets that should also be taken care of. There are many numerous ways you can consistently show your employees appreciation. You can always make sure you compliment them in a job well done whenever they deserve it, or surprise the staff one day by buying lunch. The smallest of gestures can have enormous returns because employees feel truly appreciated and they want to work harder for a great dentist. Tidbit number 6. It's all about perception, and the perceptions that matter the most are your patients and your employees. Before you became a dentist and a practice owner, you too were once an employee, and you are still a patient. Therefore, you know exactly what you want to experience, want to see, and expect to receive as a patient and as an employee. If you feel as though you need some assistance in this area of perception, just talk to your patients and staff. In a genuine manner, ask them what they want to experience, want to see, and expect to receive as an employee and a patient. Deciding whether or not to hire a dental consultant depends on how your practice is operating and where you want to see your practice in the future. So-so times or horrible times don't necessarily mean disaster is in your near future, and only a dental consultant can save the day. The smallest of tweaks can make some incredible changes, but if you feel as though a fresh pair of eyes are needed to jolt your practice, then research what kind of dental consultant you want before you hire them. As I firmly believe, good consultants give advice first, great consultants analyze data first, but excellent consultants listen first. Thank you.